welcome everyone. Good afternoon. I just need to let you know that hopefully you can see my screen and you'll see that this session is actually being recorded. So if you're shy, you can leave your camera off. We'll ask you to be muted and be camera shy for a little while because it just makes things easier for bandwidth and flow. If you require, I've asked in the chat, but I'm going to put it in again. If anybody needs an ASL interpreter, please let us know. And we will take questions after the presentations. Each person will have a chance to give a couple of minutes about their area. So you'll be able to ask questions live or in the chat. So just before we start, my name is Nancy Nesbitt, and I'm the director here at the VCC Foundation, and we're actually the fundraising arm of the college. So we find scholarships and bursaries for lovely students like you guys, so you can have some help financially. I would like to acknowledge that we are on the unceded territories of the Coast Salish peoples, so the traditional territories of the Squamish, Musqueam, and Tsleil-Waututh First Nations. So we gratefully work and play on their lands, so we want to make sure we acknowledge that. So as I mentioned, today we're going to talk about health unit coordinator, medical office assistant, and medical transcriptionist. Each presenter will have a couple of minutes to talk about it. We even have a live student who's a class leader who's going to participate in the health unit coordinator discussion. We will tell you how to win $1,000 in entrance fee at the end. And you'll be able to waive your application fee, which is for domestic students. You can waive a $35 application fee. We'll tell you how to do that as well. So to kick us off, I'm going to invite Radhika Humar to speak to us on behalf of the Health Unit Coordinator Program.
Thank you so much, Nancy. Welcome, everybody. My name is Radhika, as Nancy mentioned, and I coordinate and teach in the Health Unit Coordinator Program. I also work as a nursing unit assistant. It's an alternate name, same role, at one of the hospitals in Vancouver, and I've been there for almost 3 decades. It's been a while. I am a graduate of this program at VCC, and I can attest to the amazing opportunities that will open up to you because you have a VCC Health Unit Coordinator certificate. So after graduating from this 8-month-long program, you'll be able to easily find essential work as a professional, administrative healthcare team member where you make the difference every day that you work. By supporting your colleagues and clients and families in an administrative capacity. So you're the one who works on a nursing unit and everyone goes to if they need help, if they can't find their nurse. Let's say the healthcare team needs help with booking patient appointments or maybe clarifying a request between departments. You would also be facilitating documents electronically, or you might be using actual paper forms to complete various different tasks. So the healthcare field is dynamic. And with your Health Unit Coordinator certificate, you can work in a lot of different settings. It can be fast-paced, or if you prefer a slower-paced environment, like in long-term or extended care settings, you can work in full-time, you can work part-time, you can work casually, you can find lines that are evenings or weekends, you can find Monday to Friday positions, 7 to 3 or 9 to 5, all while earning a base rate of about $24 an hour. Now, because we are part of the Hospital Employees Union, you are also entitled to benefits, medical, dental, extended health, vacation, sick time, and I'll pop into the chat in a few minutes more information on where you can find our benchmark and some more information about the Hospital Employees Union website. So I hope that I've piqued your interest to explore a career as an essential worker, and you'll be working in under a year. And I also welcome any questions that you might have in becoming a health unit coordinator. And also good luck on the draw. It sounds pretty fantastic. And also in the chat, what I'll do is put a link to a video, and that is from the National Association of Health Unit Coordinators. It is based in the United States, but it gives you a good 4-minute video clip on what a health unit coordinator does if you're unfamiliar with it. And I also wanted to mention that we do have an information session coming up on May the 5th from 3 to 4 p.m. So I will, it will probably show on the information session webpage, the event calendar webpage later on this week. And that's it for me. And I would also like to introduce you next to our lovely class leader. We have a current group in session from January, and they're going to be in class until the end of the program in August. And Nicole Wolf joins me as the class leader for this cohort, and she'll be sharing a little bit about why she was interested in the Health Unit Coordinator program, as well as some of her experiences thus far. Nicole?
Thank you so much, Radhika. So hello, everybody. As Radhika mentioned, my name is Nicole. I am a current student in the Health Unit Coordinator program at Vancouver Community College. I am really excited to speak to you guys today about the Health Unit Coordinator program. First off, I really want to emphasize how great the program is and how much support you will receive from all of your instructors. You are learning from professionals in the field who truly love and believe in what they're doing. The course and the material that you learn is engaging from absolutely day one. You will start yourself with how hospitals run, the people who work in hospitals, professional communication techniques, medical terminology, and then go right into learning how to read and interpret physicians' orders. There's a fantastic mixture of in-class learning, lectures, group study sessions, group projects, and all of these will give you a really great understanding of how a nursing unit will work. This program will lead, as Radhika said, to an amazing career as a health unit coordinator in a field where there's always need that offers amazing benefits and amazing job security. So thank you again for having me here today. And any questions for me as a student, please do not hesitate.
Thank you so much, Nicole, and thank you, Radhika. We will give you some time for questions afterwards if you wouldn't mind posting them in the chat, folks. We are going to carry on with the next presenter, but before I do that, if you just bear with me for 1 second, I'm going to post a short poll. If you don't mind, just kind of buzz through that. It'll literally take a minute. So here we go. Can everyone see the poll? Great. Okay, so while that is rolling, just checking to see if Julia has arrived. I think she's just going to be a minute. We're waiting for Julia Slade, who will be our department leader for medical office assistant, and she'll also speak to medical transcriptionist. Julia, if you're on the call, could you unmute so we can reveal you? And if not, we might ask Domingo to talk a little bit about the entrance requirements. So that might help those of you that are here already. I think she's going to be 2 minutes, Domingo. So are you comfortable with giving folks a little bit of an overview? You have to unmute though. Or, you know, what we could do instead is maybe, do you want to ask questions? Anyone on the call, do you want to ask the questions of the health unit coordinator while we're waiting for Julia? Because I think Radhika has to go to a meeting after this. So
go for
anybody that is on the call for health unit coordinator, and if you had a question for either Radhika or for student class leader Nicole, you can just unmute and reveal your question. Be brave, you can do it. Practice your public speaking.
I'm actually just wondering what the difference is between a health unit coordinator and a medical office assistant.
That's a great question.
Isn't it, Dom? Do you want to take
Yes,
this
I've been
one?
asked that question many, many times, and I'm dying to answer, but I want to hear it from you.
That's so funny. I was going to say, Dom, go ahead.
No,
Um,
no, go for it.
So, the difference between an MOA and a health unit coordinator is really the office environment. So, either you're going to be working in an office setting, in a doctor's office, or maybe a specialty provider, or you could be working in a physiotherapist office. Where there's a multitude of different healthcare professionals in that one office,
Hmm.
where health unit coordinators work in the hospital setting. We work in acute care nursing units, long-term care nursing units. And the biggest piece of our role, which makes it different from an MOA, is the order processing. So we understand how orders are written, what they mean, the categories of different orders: admission, discharge, transfer, diet, activity, medication orders. And we also help facilitate those orders with other departments. So if there's any information that needs to be clarified, then we're the kind of the support role that allows health professionals to do what they need to do at the bedside, and we're the administrative support. So really it's the work setting that makes the difference. That's number one. And I think number two is there's a difference in pay grade. So a health unit coordinator, because of the role and responsibility, there is a little bit, order processing. There's a little bit more in terms of the pay scale. I hope that helps.
Thank you very much. That helps a lot.
Hmm.
There was also a question about whether you were full or not for September 2021.
It's a great question. So we've had a very strong interest in January, and we were over class size. Nicole is part of that. And so unfortunately, we don't have anyone here to represent the registrar's office, but I do know that the folks that weren't able to get into our January class were asked if they would like to get into September. And I believe the Reg office will be looking at applicants at the end of May, beginning of June, to see if we have a full class or not. So I'm so sorry that I won't be able to definitively answer that. So I do encourage, if you would like to apply, right now is the time. Your application fee is waived. And so there isn't that administrative $35. And, if you continue to work on the entrance requirements, perhaps if you aren't able to get into September, then we'll work on providing you with an opportunity to move your application to the next intake.
I'm gonna answer that as well because every time I talk to students, they always ask, "Is there a wait list to get into the program? Am I gonna be waiting for a long time to begin?" And I keep on saying to apply to the program because just so you know, when you apply to the health unit coordinator or to any program for that matter, like medical office assistant or medical transcriptionist, we do have several intakes for each program. Okay, however, seat offering to these programs is first come first qualified. So that's why I always say don't worry about when you're going to receive your acceptance letter. Worry about how are you going to meet the requirements because at the end of the day, since our policy is first come first qualified, we're not going to offer you a seat not until you meet all the requirements, right? Because once you meet all the requirements, the system will not forget you. The system, our banner system, will automatically say, "Hey, this person has. We're ready to send this person's acceptance letter." And we usually, and this is what we do, we send out acceptance letter 3 months before the program starts. So for example, if you say, "I want to start for September 2021 and it's now June or July and you haven't received your acceptance letter," that means there's two things here. Either you're not going to get the acceptance letter, or you're maybe available to begin the program in the next intake. However, a lot of people sometimes, even with they already received the acceptance letter, not all of them will say, okay, yeah, I'm gonna do it, because some people, they change their mind. They want to get married. They want to have a vacation in Hawaii, what happens to their seat? We're gonna offer it to somebody else, right? And that seat may be offered to you. And this is the reason why, again, it's first come, first qualified. Make sure to apply online, submit all your documents, make sure that you have all the requirements, right? Because that's very, very important. Okay? So
good advice, Domingo. But I really want to take that seat to Hawaii, please. Just one last thing before we let Julia speak about the other two programs. There was a quick question about, there's been a change in curriculum apparently. So there's a person asking if you could provide a sneak preview of the differences between the old and the new curriculum. And then we'll turn it over to you, Julia. Hang in there.
So that's a great question.
Ridiculous.
Yes, that's for me. So Salome, I put a little answer to your question at the bottom that in the new curriculum, there's an emphasis on digital skills, because computer literacy is really, really important in the role that we play. So how we communicate is using a computer system. And so that digital literacy, getting your keyboarding skills up, showing you how to open Word documents, PDF documents, saving them, talking about different devices, scanning, emailing, all of that. So we've added a course called Information Technology, and we also want to provide students with, that blended learning opportunity. We have embraced it because we're in our second blended learning model. So we're going to continue with the advice from our public health officer, and if we need to continue in this alternate delivery mode, we will. And the other big piece is we looked at our clinical skills, and normally in the current program, the practicums are placed at the very end of the program. But now what we've done in the new curriculum is move the practicum so that you have a practicum in term 1 and another one in the second. The terms are semesters. So one in semester 1, one in semester 2. And that's really important, because now you have a taste of what it's like to be in the hospital. You come back to semester 2 and it's progressive. You bring, that transfer of learning back into the classroom, and it just allows you to embrace the concepts a little bit better. And then one final question, I think, is the entrance exam. So in the new curriculum, we don't have an entrance exam, just an information session for you to attend. And it just provides an opportunity for me to ensure that this is the right fit for you. So I give you some information about what it's like to be in the program, what it's like to be employed, some characteristics, and answer any questions that you might have. Okay.
Thank you so much. Okay, I'm going to move on to Julia, because we want to make sure that we get some time for medical office assistant and medical transcriptionist. So Julia Slade, I'm going to turn it over to you.
Thank you, Nancy. Can everybody hear me okay? Okay, I'm using a bit of a MacGyvered microphone here. So welcome everybody. Thanks for stopping by and hearing about the health programs. My department is responsible for offering the medical office assistant program and the medical transcriptionist program. So with both of these courses, there's some overlap, there's some similarities, but they are both very different programs. So I'll start with the medical office assistant. That is a 6-month long program. It's offered twice a year. We have 2 intakes. It used to be that medical office assistants really only worked in doctors' offices. they still do that, but there's a number of other places as healthcare has changed. So has the roles and the responsibilities of everybody in the healthcare team. And MOAs not only work in doctors' offices, they work in clinics. That includes in ambulatory clinics, in large multi-provider clinics. MOAs also are needed in community events, anything that has health services provided. They also need MOAs. So it's not what your maybe mother or grandmother remember as an MOA role. You will start off with the foundational pieces, which are medical terminology, levels 1 and 2, and with a keyboarding course. As more of the health records have moved into an electronic version, that keyboarding is even more important. And so it's not just the speed we're looking for, it's the accuracy. So these medical documents are legal documents, and so that piece of it is really important. After the foundational pieces, then you start to explore a little bit more. So we have an electronic document formatting course. You'll get acquainted with all the Microsoft suite. You will also move into term 2, where as you get closer to practicum, you are getting more specific skills around tasks that you'll be doing in your workplace, and also learning about the healthcare system that we have in the province and where your practice may fit in. You have a 3-week practicum at the end. This is a great opportunity because our hosts and partners we've been working with for a very long time. We trust them, they trust us, and we're happy to send our students to them. They get a great experience. Often students will get a job offer while they're still in their practicum, or at least indication that that might be coming. Think of it as, obviously an employer would much rather hire someone they know than someone they don't. And they've just had a 3-week opportunity to see if you'll fit. So it's a great thing. A number of other organizations have students find their own practicums, and for many, many, many different reasons, that is a very poor idea. You don't know what we're doing behind the scenes to vet the people that we work with. And plus, at the end of the program, it's just another added burden onto students. So that's what you can expect in the medical office assistant program. As Radhika was saying, much of the focus now is moving into an electronic delivery area. So you will be doing a billing course that's electronic. You will be doing scheduling, starting to look at charts, and there's just more of that coming down the road. Okay, so for medical transcription, this has some similarities to the MOA program, primarily in the terminology. It, however, is an 8-month program. Both of them are full-time, which means Monday to Thursday, with Friday being a lab day. So that applies to both of the programs. Friday's lab day is about giving students an opportunity to catch up with the week, to do any group work they need to be doing, to finish off assignments, to study from the previous days. And so if people do not have any of those things to do, then some students use it as an opportunity to pick up a shift if they're working. One thing I will say about both programs and work is they are both intensive programs. There's no use to you going into it not knowing that. So it is a full-time program, both of them, and the pace is quite rapid. So that's why it's really important to take advantage of those lab days, because once you fall behind, it can be very difficult to catch up, okay? The thing about transcription has also more and more moved from just your old dictation to a more electronic delivery and receivership of those reports. As in MOA, accuracy is hugely important. As a medical transcriptionist, you are making the living document of what that patient's experience was with the healthcare system. So accuracy is hugely important. The difference between the two programs, the biggest difference is medical transcriptionists, they tend to work alone. So there's no patient interaction. They are usually working in a hub or at one of the main centers for transcription, or a lot of people actually make a home business out of this and go and recruit their own clients. And toward the end of the program, the instructor goes over the steps that you would need to do that. Your program also ends with a 3-week practicum. And again, we have a very solid list of partners and hosts that work with our program and with our students. Trying to think if there's anything more. I think the biggest thing to be aware of is just, you know, doing a little bit of research and seeing what that role looks like now, not what it looked like 20 years ago, and recognizing that there's more and more opportunities in both programs as healthcare changes, as the delivery changes, so does the role of everybody in there. And it's a lot more varied than you might initially think. So just to keep that in mind. People who like solving things, like getting information, clearer information to places that it needs to go, solving puzzles, making things flow more smoothly. Those are all qualities that apply to both programs. The transcriptionist is just in a more solitary role, whereas the medical office assistant is interacting with people all day long, and not just the team, but the patients as well. So that's an important thing to keep in mind. And I can take any questions if there are. There is a question about class size. Right now, what we know is that we're supposed to be preparing for a return to face-to-face in September. That's what we know right now. So that is what we're doing. And we haven't got a lot of the details yet from the committee that is working on that. But you can check in as we go along. The class size won't change, but there may be a possible splitting up of the class so that there's less people in one room at one time. We will get all those details. The VCC is working on it, but I would be remiss to start talking about what's going to be in place, 4.5, 5 months from now. Can I answer anything else?
Does anyone want to just unmute and ask a question? Or you can type into the chat. I think so far, both presenters have answered everything that's been in the chat, as well as Domingo and Angela have been jumping in.
Great.
But if you had a question, now's the time.
Now's the time. What I can say, one more thing to add is there is a keyboarding criteria for both programs, and for our students in our programs, you would go through me currently until we're back face to face in September. You would contact me, and I would set you up with your keyboarding assessment. Okay, so that's something to think about. And until we return to face, the department is covering the cost of that for you.
Is that Julia? Hi.
Yes.
Are you referring to the keyboarding?
Yes.
Oh yeah, the VCC assessments right now, they're open now for keyboarding tests.
Are they? Okay.
Yes.
That's great. I saw your note there, Domingo, but
yes.
Our department always combined for people who show up for the info sessions.
Okay, gotcha.
We always provided a waiver on the
Okay,
keyboarding.
gotcha.
Yeah.
Yeah. So I just want to make sure, but the keyboarding test right now is open in person at Vancouver Community College, but you need to email assessments@vcc.ca, just because you need to schedule prior to coming to the assessments, right? Because of COVID, we need to properly observe COVID safety protocols.
Right. Good point. Thank you.
You're very welcome.
So I put up your next info sessions there, Julia. So you have something coming up on May 18th?
Yes, May 18th. And we actually do the info sessions together, because people who are generally interested in healthcare, but they're not quite sure where they fall, it's usually really helpful for students to listen to both. And we've had a lot of crossover as well, where the medical office assistant students get to the transcription course that we have in MOA, and then they go, oh my goodness, this is what I want to do. And they end up, probably most of them complete the MOA, but then they go into medical transcription. And it does happen vice versa as well. Some people find that it's a little too solitary for their liking in transcription, and they want to come into the MOA program. So that's why we deliver them together.
Thank you for that. And I think, Radhika, yours was May the 5th, right? So if anybody missed that, there is a health unit coordinator one coming up on May 5th. I'm sorry it's not on the slides. I just wanted to remind you. Did anyone else have any further questions here? We have a few more minutes left.
Yeah, I encourage everyone to ask questions now, because this is the best time. We have we have our department leaders present right now, and they can answer your questions if you have nitty-gritty, details that you need to know about medical transcriptionist and medical office assistant and health unit coordinator. This is the perfect time.
Hi, good day, everyone. My name is Kimberly. I wanted to know if what's the time period? Of course, I entered the meeting late, and I'm actually trying to browse online to find some information, but seeing as though the respective persons that I can speak to are here in this meeting, I wanted to know what's the time period for both the medical transcriptionist certificate and the medical office assistant certificate, And what are some of the requirements? I have not reached to the website as yet to look for it. So
I can talk about the, can you unmute yourself, please? Sorry. Yeah, thank you. For the admission requirements for the medical office assistant and the medical transcriptionist, for medical office assistant, we require English 12 with a B, okay, or equivalent. Now, for the medical office assistant, we require C+, okay? Again, I want to make sure. So for the medical office assistant, we require English 12 with a C+. However, for the medical transcriptionist, we require English 12 with a B, okay, or equivalent. Now, both programs, I would say, I would even include the other program. They require keyboarding tests as well. Okay, as I said, the keyboarding tests you can get that in person at VCC now. However, you need to email assessments at vcc.ca. Now, as far as the English 12 requirement is concerned, if you do not have the English 12 with a B or equivalent, or even the or even English 12 with a C+, you can always take the Duolingo English test. Okay, so I can put that in the chat box. Hold a second. I can. Where am I? There you go. So I'm gonna put that in the chat box. You can just Google Duolingo English tests, and I'm also gonna put the best score. Okay, the best score is 110 or better, and this is actually 110 over 190. Okay. There you go. So if you want to apply for medical office assistant, health unit coordinator, and medical transcriptionist, if you want to get that, if you want to get in, you can take the Duolingo English test, and if you get 110 or better, you're perfect. You're good to go. And this will also give you the English language proficiency. Okay.
Sorry to just jump in very quickly, because I was actually talking to Kimberly in the international dropping advising session earlier.
Sure.
So I know that she's an international student. So Kimberly, just to answer your question very quickly, the medical office assistant certificate is 6 months, which allows you to work part-time during the studies, but it doesn't lead to a post-graduation work permit because it's less than 8 months. The medical transcriptionist, on the other hand, is an 8-month program, which allows you to work part-time during your studies. And upon graduation, you can apply for a post-graduation work permit that is 8 months in length. So you can have the Canadian work experience. That will be beneficial. Yeah, sorry, I just want to jump in to say that very quickly.
No worries. No worries.
Thanks, Angela.
There's a question about whether you can, for an MOA or a HU, or sorry, MOA, whether you can just train on the job. And I would say it's not a good idea, and not very many people even offer that anymore. Healthcare and everything about it is much more complicated now than it used to be. You're not just sitting at a desk and filling in the appointment book with patients' names and times. There may be a few people that still offer that, but they are few and far between. And that actually is a good thing, because it's recognition about the importance of the role that you take. And obviously, when you graduate, you're going to be usually applying at an entry-level position. But what if you end up really liking the data entry aspect of it, and you go and work for a researcher, wherever that researcher works? What if you decide that you'd like to start working on your leadership skills? There are office managers and more supervisory positions as well. So you can take the MOA as far or as close as you want to do. There's people working in very, very interesting jobs that started with that entry-level position, because really and truly that's where everybody starts, no matter where they are.
There's a question here from Meryl. I have a BA in political science from UBC. Am I still required to take the English language proficiency test? And the answer is no, you are not required to take the English language proficiency test. Okay, so your degree from UBC supersedes that requirement.
And there's one more question here. Do you need to sign up for both the MOA and the MT, or just the one? And they're offered together, so it's counted as just one session, same day, same time. So on the 18th at 4 o'clock.
That was for the information session, right?
That's right. Yeah.
Perfect. Thank you. Okay, how are we doing for time here? Did anyone else have any more questions? I'm going to just quickly go through the formalities to make sure we cover everything for you. And then if you slip one more question there, we might be able to accommodate. But I wanted to make sure that you're aware of what services we have available for students here at VCC. So we've talked about advising. So if there's a question that either Domingo or Angela hasn't answered, you can always try advising at vcc.ca as well. We offer financial aid. So if you're struggling and you need some help or you need to apply for some financial assistance, definitely check that out. We have an Indigenous education department, so please check them out as well. Disability services, counseling services, and then there's also free professional tutoring available. So the next steps, sorry, anything you wanted to add there, Domingo?
Oh, no, I just want to make sure. Yeah, student loan. All these programs that we presented today, they're open for student loan. Okay, so you can definitely apply for a student loan, but here's my caution: do not apply not until you receive the acceptance letter, because that's not going to work. The only time you can apply for a student loan is when you receive your acceptance letter that says, congratulations, you got in. And so that's it. Then that's the time. And we usually send out acceptance letters 3 months prior to the start of the program. Why 3 months? Because that's the time you're going to be obviously applying for a student loan, just in case you don't have that money to pay. But you can definitely there are available bursaries and scholarships at the college. We have the financial aid, and if you do have inquiries, please connect with them. And I think Nancy has already given you the link. There you go.
Thank you. Thanks, Domingo. So yeah, your next steps, make sure you check out an info session. We've mentioned 2 here today. And then also you could meet with an advisor, apply or register at vcc.ca/apply. We did also mention that domestic students can have their application fee of $35 waived. So if you apply before, I believe it's April the 30th, there's a code there at the bottom of the screen. It says info 0421. So that is not info, it is info 0421 is your special code to save 35 bucks. Who doesn't want to save money? And then finally, I want to make sure that you know there are also a few entrance awards that we're giving out. So these are $1,000 value in tuition credits. So check out vcc.ca/experience. Your code for today is experiential with the capital E. And enter to win there, you may be able to win $1,000 in tuition credit. So that's pretty awesome. I'm just skimming the bottom of the list here. I think most people have had their questions answered. I did see one fly down about, is it too early to apply for 2022 for any of your programs? Ladies, did you want to speak to that at all?
I'll just say that if you are thinking about either of this department's programs, so MOA and MT, I would encourage, and I do encourage students to apply even if you're still thinking it over, even if you're still not sure, it is $35, and if you're here today, it's free to get your application in, because our classes do tend to fill very quickly. Like for September, I think there's only 2 seats left already, and we're just in spring. So it's always easier to back out and go, no, I've changed my mind, than it is to go, oh, I should have done that. So just put that application in, and then you decide the rest as you go along.
Yeah, I can't stress enough the importance of applying online to the program. Again, I know I'm repeating myself here. I keep on saying just apply, apply, apply. Please do apply and just submit all the documents, noting obviously of meeting program requirements. You know, it's easy to it's so easy if you receive the acceptance letter and you decide all of a sudden it's like, this is not the schedule I want to, because I want to enjoy my vacation in Hawaii. Well, if that is the case, we'll give that seat available to another person, right? So there we go. It's easy, rather than, okay, I'm not gonna apply, I'm just gonna wait, because you can't do that. You can't do that, because if you're waiting, guess what? People are applying, and they're applying every day. As a matter of fact, every minute. So even if we if you ask questions like how many already applied, well, that's you know, it changes. It changes every second, because again, at the end of the day, they can apply online, and I don't want you to miss the boat, because these programs are amazing. Medical transcriptionist, MOA, health unit coordinator, amazing programs, and their employment rate is pretty high. So again, I can't stress enough the importance of applying, especially today, because we are waiving the admission fee, and you have until April 31st, I believe, to waive the admission fee of $35. And you know, right now, $35 is a huge amount of money. Okay.
Okay. Oh, Radhika's saying 100% employment rate for health unit coordinator.
There you go. It's true. 100%.
Nicole's like, yeah, that's my job future. Class leader, Nicole. Yay. Okay, Julia, there was a few more questions, and one was around booking. You had mentioned that I think it was around the test that can they contact you directly, or do you just want them to go to the info session?
No, they can contact me directly, Nancy.
So jslade@vcc.ca?
That's right.
Okay, so the person that asked about booking the test, can you email Julia and work out a time? Okay, folks, I think here we have one more. I think processes and evaluation. Oh, okay. I believe Angela's answering all those. And I'm sorry to the person that paid their $35 application fee already. I can't get it refunded. I'm sorry.
Yeah.
If I had the power, I would, but I don't.
No,
Shanaz,
yeah.
sorry, what were you saying?
Yeah, I'm just wondering that May 18, you have a full session on healthcare, right? May 18th?
May 18th is the info session, yes, at 4 o'clock.
At 4 o'clock, okay, that's the thing. Okay, thank you.
Okay, you're welcome.
I just wanted to thank you guys for your time. These info sessions are really amazing, and yeah, I'm really glad that I came. Thank you.
Oh, that's good to hear.
Thank you.
Thanks. It's nice to have good feedback like that. Thank you. And I just want to shout out to the organizers in the background. There's Danielle and Frida are lurking to make sure we're going smoothly. So thank you for organizing things. And thank you, Angela and Domingo, for answering all those advising questions. And of course, to Radhika and Julia for department leading and showing us the way. And as well, Nicole Wolf for being our student class leader from Health Unit Coordinator. It was lovely to have you. So I think we've given you a lot of information and a lot of contacts. So definitely follow Domingo's advice, apply. And if we missed anything, advising@vcc.ca. Someone definitely can help you.
Yep.
Is everybody good now? You're also hidden, so why don't you undo your cameras and just wave goodbye to me, so at least I know you were there. And
Oh.
Yay, thanks, Boone. Yay. Hello, Zoom user. Hi, Shanez. I know it's probably illegal, but I don't care. Hi, Kimberly. I know you came in late, but so make sure you check out the website and ask more questions if you need more answers.
I will. Because I came late, I'm not sure what the acronym HUC means. What is that?
Health Unit Coordinator, and I'll type it in the chat for you.
So Kimberly, that's the program that's not open to international students. Sorry about
that. Right. Sorry.
I hope to see you soon in a different program.
Okay. I'm looking at the medical transcription program.
Right. Medical transcription or the medical office assistant. Okay, everyone. Well, have a fabulous afternoon, and thanks again for coming.
Thanks, everybody.
Thank you for your time.
Okay, bye. Have a great afternoon.